There are more than 800,000 joint replacements done each year in the United States, and that number is going up.
The baby boomers tends to be a growing population. The weekend warrior, recreational activity patient is also has a growing interest now in getting back or staying involved with their usual activities.
UAB orthopedic surgeon Herrick Siegel says new techniques and new materials mean those weekend warriors are increasingly candidates for hip replacement. New ceramic and cross-linked polyethylene replacement joints can last up to 40 years.
And these are not the same hips that were put in the 80s and 90s. These are hips that'll last perhaps a lifetime in many patients.
Rob Ashurst hopes so. He's just 40 and has a new hip. Fitness and exercise have always been a big part of his life. He was doing CrossFit at Iron Tribe Fitness Center when he felt a tweak in his hip, his first indication that he had avascular necrosis, or blood loss to the head of the femur. He endured increasing pain for 4 or 5 months and then came to Dr. Siegel.
When I went to Dr. Siegel, he was like, you know, the point of this is for you to get back to, you know, living the lifestyle that you want to live. I waited, I think, about a month, and finally one day it was hurting so bad that I picked up the phone and called him and said, hey, when can you do this?
Rob was back at work within a week and a half and back at Iron Tribe in 3 months, performing the rigorous CrossFit regimen even better than before his hip replacement.
And I really figured I'd be one of the slowest ones in the class, but it ended up I beat everybody in the class the first day.
Siegel says a new procedure, the anterior or front approach, is proving useful particularly for younger patients. It's best done on a special operating table, first developed for hip fracture. UAB has 2 such tables and is likely getting a third. Siegel says the anterior approach means less pain and a quicker recovery.
We come into the front, we're dividing muscles as opposed to cutting through them, so it's really a muscle-sparing approach in a sense.
For Rob Ashurst, it means he can live the life he wants to live.
It's like getting up in front of a class when you have to give a presentation and you either go first or last, but either way you're going to have to do it. Well, you might as well go first and get it over with so that you can live the rest of your life pain-free.